Hello, I am here today with Dr. Nita Sharma Das. Dr. Nita is an author, medical writer, and educator. She has experience of more than 15 years in the Indian healthcare and education industries with a strong niche in healthcare writing. She has regular publications in renowned national and international magazines for various disease profiles and treatment options, home remedies, health fitness regimes, herbal medicine, and well-being. Currently, Dr. Nita is working as a head of the Department of Biocosmetics at BioQuantum Academy, Canada. As per academia, she is Doctor of Naturopathy and did her PhD in alternative medicine. Herbal medicine and nutraceuticals are her specialization and area of research. Dr. Nita is the founder of Nita Natural. Nita Natural is crafted to have direct interaction with everyone interested in knowing about the best use of herbs, natural therapy, impacts of nutraceuticals, and secrets of a healthy lifestyle. Her passion for unfolding the wealth that nature possesses gave birth to her first book, The Herbal Remedy. And Dr. Nita launched her second book, Welcome to Second Spring, which describes unpausing your beauty in and around menopause as a new hope for women during and after the menopausal transition. Both books are available on Amazon. And Dr. Nita, I am so excited to be talking with you today. Thanks for agreeing to have this conversation.
Thank you so much, Vanessa. It is actually nice to talk with you, and this virtual meeting, I hope it will be amazing experience for both of us.
Yes.
Thank you for your great introduction.
Wonderful. Well, I do have a couple of questions that I would love to ask you. The first is, why do females over the age of 40 need health attention?
Yes, it is a great question. I must say this. But I specifically mention women here because actually we are different from male uh, personnels because our anatomical and physiological growth are something different. So this difference is actually started at very beginning at the fetal development status. So during our fetus development, the gonadal steroidal hormone actually impact our brain development. So we are different from male personnel, and our heart is quite differently work than male professionals. That's why I am mainly concerned about the female health. So after 40 years of age, there is sudden changes of hormonal imbalance, and that impact our overall health. If we are considering our heart health, usually the premenopausal woman has less blood pressure or lower blood pressure level, but with increasing of age at the menopausal transition, their blood pressure level is gradually increasing. And I feel in during this period we have to take care of our cardiac health, as well as this sex steroids hormonal impact is so influence in our body that we are facing challenges in the blood flow. We are facing challenges in lipid metabolism. We are actually changing our blood coagulation process. Electrolyte imbalance is there, so these actually causes the hot flush, then mood swing, and mental uh, some time of mental disbalance, or sometimes we are facing depression or anxiety. So after 40 I feel that we should concern about every potential changes which we observe during this time, so that we can detect early diagnosis if anything is very much concern. Something like bone density is going down, or metabolic declining process, maybe uh, give birth to the diabetes or thyroid kind of problems. So I feel that after 40, when we are in the menopausal transition phase, that time our hormonal imbalance is impacting our overall health. So we have to concern about it.
That is, I'm in such agreement with that. And I love the fact that you are talking about how important it is for women over 40 to really focus on their health, because as we know, a lot of the scientific studies that are done on men, and men, as you said, have a different physiology. And so it's really important that we start focusing not only individually, but as a community on women's health and what the impacts are. So I love this conversation. And as you were talking about women over 40, and as we're maturing and aging, I'm just wondering, from your point of view, what do you view as the initial signs of aging?
Yes, actually, initial signs of aging is something that is very important to concern about, because our skin is the largest organ of our body and it impacted so much when aging is uh, initiated. And there are many signs that are mainly focused first on the skin. If we are notice them in the early, then we can have that our chronological aging is going on, and that actually impact our biological process. Sometimes it can be prematurely happen, so we have to very much concern about that sign, like forehead lines, or laxity in the upper lid, or that descent of corner of the mouth, or wrinkle in the face, or wrinkle in the lip, or in the crow-like crow-feet-like structure in our eyeside, or pigmented spot. These are the some very common sign that actually shows that our body is changing with time.
Yes, and I want one of the things that I often talk about with women is that while we definitely want to be focused on what's happening to our bodies as we mature, we also really want to understand that these are natural processes. And, our culture can be so focused on youth and what that looks like. And so I love this focus on, well, let's talk about what it's like to be healthy as we mature and as we age. And as we're talking about these signs of aging in our skin, I'm wondering if you can explain a little bit more about what are the factors that influence the skin maturing and skin aging processes.
Yes, Vanessa, it is a very crucial and very important question. Actually, when we are talking about skin care or factors that influence our skin aging, everybody is thought about that we are actually talking about holding back our age or youthful appearance, or we are concerned about the age-defying look. But I am actually very much concerned about the premature aging. With age our bodies changes, that is very natural. But if it happens earlier, then it must be a concern. So some factors are external, which can we stop or we can maintain, and some intrinsic factors obviously impact our body that may not be in our hand, like the genetic factor, or some metabolic disorders, or hereditary disorders, or unwanted surgery. So these can impact our physical appearance. But if it is because of sedentary lifestyle, or if it is maybe we are taking too much of high fat diet or junk food, or we are not concerned about our physical exercise, or we are exposing to the sun too much, or toxic environment, and we are not taking care of our skin hygiene, and we are not moisturizing our skin, then it is very very bad for us, that actually these factors actually promoting the premature aging. So obesity, then underweight, then dieting, improper dieting, I must say here, improper dieting. These are some factors we can control, and we can delay our aging process. So this is actually taking care of overall health, not just skin. So that is my point of view.
And I love the fact that you have talked about how there is a very clear difference between the normal natural process of maturing and premature aging, and the signs that we can see in our skin, and also some of the things that are contributing to that. And I think that's really important for people to hear, is that there are many things that we can control that can be contributing to premature skin aging. And I know that you talk about a difference between a skincare routine and a skincare habit. Can you tell us what is the difference between those two, the difference between a skincare routine and a skincare habit?
Of course, this difference, we must know about this, because skincare routine is something that is structured. We are mainly following a cleansing, then exfoliating, then toning our skin, moisturizing, and sometimes treating our some skin concern. These are the skincare routine actually required to maintain the skin health. But skincare habit is something that is behavioral. We have to more focus on the skincare habits, because we have to develop this habit, because nothing is come in one day. If we are taking care of hydration level in our body, if we know that we have to stop exposing unnecessary sun or uv rays, or we must concern about what we are intaking through diet. Does we have some deficiency in our body, so that this actually overall practice that mainly impact our overall health. And as skin is the window of our internal body, that naturally reflects what is going on inside our body. So I feel skin care routine is obviously very important, but skincare habit development is very essential to maintain overall skin health for long term basis.
I love that distinction that you make, because you're so right. You know, we can create a skincare routine, but if that doesn't become a habit, it's not going to help us. We can't just do something once or twice. We really need to make a habit of it. And I know that when I talk about healthy routines and regimes, I love to incorporate them into rituals that, feel really good to do, so that it helps us to really root that habit in to something that feels good for us to do over and over again. And so that is so important. And so when we're talking about the things that influence premature skin aging, and now we're talking about these habits, I'm wondering, what kind of suggestions do you have that we can bring into our habits and our routines to control premature skin aging?
I'm glad that you are agreeing with my point of view, because sometimes I face challenged, because when we are talking about skincare, they are mainly uh, most of the people have the mindset that we are concerned about the aesthetic beauty, but it is all about internal beauty we are promoting, and that actually reflecting through our skin. So yes, I love to give my suggestion in this aspect, that we always try to go through whatever product we are using, that ingredient list is required to know about that what product actually we are applying, how much chemical load we are doing in our skin, because skin is always exposed too much of chemicals or pollutions. So we have to deal with that. So in that case, maybe some, if anybody is interested, then definitely one for one should take education in this field. And I am the co-head of the Department of Biocosmetics at Bioquantum Academy. And there we are giving education related to natural skincare, natural hair care, nutraceuticals, nutri-cosmetics. These are something anti-aging process. These are something which are very innovative way to deal with the premature aging process, not only for skin but overall health. And we are, that's why we are providing different kind of diploma certification. So if anybody interested, then they can definitely register for that. Otherwise, book reading is very good initiative to take care of your overall health, because reading is something that initiate your inner feeling. You become aware about what you are doing. So, and as well as it is entertaining also. So if anyone is love to read books, then Welcome to Second Spring is one of the choice that I already mentioned, and that this is my second book. And maybe this reading of this book give gist about the menopausal transition, as well as how we can deal with every aspects of skin health as well as mental health, so that we can gradually accept our aging process and we enjoy the graceful aging. Another thing I just want to add here, that with my experience, I observed that counseling is a best way to receive something at the age of, after at the age of 40 or 45 or 50, because at the young age we are not that much recessive, but with aging process is going on, we want to learn, we want to explore more, because now our wisdom allow us to receive more and more information. So counseling is another way. So Nita Naturally is the website of mine. There they can book consultation, and I will be happy to help them for overall health, including skin health uh, improvement.
Mm. I love that you talk about skin health being a reflection of what's going on internally. I think that's so important for us all to remember that it's all connected, right? Like nothing is separate from anything else. It's all connected and it's all a reflection of what's going on. And I also love how you speak about this menopausal phase of life as a time when we're much more receptive and interested in learning. And that's also something that I really speak to myself. And I see in my clients, you know, that women are really hungry to learn how to take care of themselves at a much, much deeper level. And so I just want to thank you for doing this work and congratulations on the two books that you have put out there in the world. And once again, I just want to mention they're available on Amazon. So if you are interested in learning more about what Dr. Nita has shared today, I really encourage you to look up her books and to connect with her and talk about, how she can support you. And as we are closing and wrapping up here, Dr. Nita, is there anything else that you would like to share with us before we go?
Yes, actually, it is a great conversation with you, Vanessa, because our mindset and mental wavelength is connecting, and we are very much potential to do the promotion of the skin health. So that is very important, and I love this conversation. Thank you so much for your time.
Well, thank you so much for speaking with me today, Dr. Nita.